that I think you're going to dig. So kick back, relax, take some notes. And as you can see, when you start to look to the right side of the screen, you can see that the room is starting to go up pretty quick. So as a courtesy, we'll give it one more minute and then we're going to go right into it, of course. So we got a lot of, you know what I dig about this? I'm going to tell you, where do I begin? One of the things I dig about when we do this is we don't do this a lot. I think last year we might have done this, I think I want to say twice, aside from Thursday Night Lives. The Thursday Night Lives were very, very cool. We may bring them back. We do everything based upon your input. In other words, if you dig something and you like something and you love something, then communicate with us, because if you want to see more of something, we can do that. And when we do these webinars are meant for content. They're meant for training. They're meant for education. They're meant to be able to give you something that you can walk away with, and something that you can potentially plug into your practice right now. That's what we want for you. That's what we wish for you. That's what we hope for you. And that's what we know for a fact you'll be able to do. If you know anything about Dr. Kaplan, you know that he's going to go into the deep end of the pool here today. He's not going to go in the shallow end. He may start in the shallow end, but he's going to go into the deep end of the pool only because of one simple fact. And that fact is that this is dynamic. This information about non-surgical spinal decompression, whether you do it, whether you do it a lot, whether you're just thinking about doing it, whether you want to get started with it, whether you want to do it better, you're going to be able to take content from here today that you'll be able to apply to your practice and to be able to say, you know what, that was a good idea. I'm going to use that. I want to use more of that. I want to learn more about that. So this is a lot of fun for us because this is the first one of the year. Very, very cool. First one of the year. Very exciting because there's all new material. The field of non-surgical spinal decompression changes very, very fast. And one of the things that I love about Dr. Kaplan, holy cow, where do I begin? A lot of you don't know this. You know he's been in my life. Ready for this? This year is the, let me show you, can I do numbers? Can I do like that? Is that 34? You know he's been in my life for 34 years. How many people know that I was actually his associate doctor 34 years ago? How crazy is that, right? Is that nuts? So you want to talk about a relationship that has been probably the envy of many, and it would be the envy of mine too if we didn't live it, have it, share it, and do it every day. He's the most knowledgeable person by far, light years in this area. And I know if it's me, and I'm in the world of disc, in other words, I want to bring a better package to my patients. I want to help my patients get better results. I want to be able to underpromise and overdeliver. That's message number one for today. Underpromise, overdeliver. That's one of the things we love, love, love about our disc centers of America doctors, plenty of which are on this training. So why are they on the training? Well, the reason they're on the training is because they know it may just be one thing, just one thing Dr. Kaplan shares, one thing in terms of the way he phrases something, says something, educates in some way, shows a graphic, and does something that you could say, you know what? That was a great idea. I love that. I'm going to start applying it to my patients right here and right now. So we're going to go into it right here, right now. The room still is going, as you can see. The room is starting to get, this could be, I don't want to say it's a record because the last one was a record, but I think if we break 100, that's pretty good, right? I think we're on our way. We're getting there, right? Pretty close. But I'm thankful for the ones that are here now, giving up their time, their energy, their effort, to be able to learn one thing in the world of non-surgical disc care, that as chiropractors, we get the opportunity to be able to deliver a better product and potentially a better outcome. So what we're going to do is, fingers crossed, everybody, we're going to start to show some slides. Let me know if you see these. I hope you can see these. Let's take a look and see if, hopefully, you can see what I'm looking at here. Let's see. Come on, baby. All right, not bad. Can you see that? I think you can see that. How about now? Can you see this? Whoa, how about now? Can you see that? Here we go. Not bad. All right. Perfect. I think we're in motion and we're ready to go. Beautiful. All right. Can you see that? Raise your hand if you can see that. Dr. Park, thank you, brother. Dr. Partiti, so cool to see you, brother. I'll see you in 4 weeks, man. I'm so juiced for Cream Ridge and Hamilton. 4 weeks, countdown, right? Yeah, less than 4 weeks. So many doctors that we're so excited for that really are reinventing their practice, reinventing themselves. I think that's a theme for 2021 is to reinvent yourself. There's nobody on the planet, I mean nobody, that has reinvented himself better. Why? Because he's so hungry for knowledge. The one thing that I know, and I know a lot about Dr. Kaplan, is he will never, ever, ever rest on his laurels. He wants you to be a better version of yourselves. That's the one thing that he's lived by. It's the one thing that he educates on. You'll get a taste of it here today. So let's make sure that you can see it. And the reality is this. The reality is if I'm on this Zoom training right now, what I want to learn is I want to learn how to do what I do better, number one, but I also want to learn it from somebody who is in the trenches. I want to learn from somebody who's lived the life, lives the life, and created the trainings, the content, the education, and the materials. And I could talk about his resume all day. He's the president of Disc Centers of America. He's the co-chairman of the International Medical Advisory Board on non-surgical spinal decompression. He is the co-chairman of the International Disc Education Association. He's the creator of the most regarded, highest, I would say highest positive feedback of any CEU program since 2012, which has been taught now in 3 universities, at Parker University, National University, and its new home now at Life University. And we've got big news in 2021. He is the creator of the National Spinal Decompression Certification Program, and he has created more disc specialists as chiropractors on the planet than anyone else. It is my pleasure to introduce Dr. Eric Kaplan.
So where do we begin? You know, most times you begin at the beginning. So let's start with the basics, and I'll build up to this. As you're looking at this one graph, let's start with right now. And if you know this, raise your hand. How many people know that Tiger Woods just had his 5th back operation? That's pretty wild. I mean, and one of the things that so surprises me, and one of the things that we work so hard at boot camp. Now, people say, what is boot camp? Boot camp is something that we do for our clients. And boot camp, I would tell you, it's more like a one-day MBA. It's understanding the business. It's understanding the closing. It's understanding, because let me tell you what Perry and I have discussed, and we know as a fact, the middle class of chiropractic is going away and will soon be gone. You're either making it or you're not making it. So what's the difference? You're either insurance dependent or you're interdependent. So I ask you a question as I begin. How many people here would survive if there was no insurance? Now, the question is a tough question because we like insurance, yes, but what if I tell you the reimbursement rate continues to decline? Yet, look at the slide. Americans spend over $50 billion each year on back pain. Outside of the common reasons for the hospital, of the cold and the flu now due to the pandemic, but before this, it was the second most common reason that people would go to the ER room. I mean, back pain is big business. How big is it? Well, look at all the people that are in this room today. Obviously, you're in the back pain business. And some of you are doing it better than others. Some of you say, well, you know, I don't know if I'm closing them right. See, if there was a weakness within our profession, okay, is we had so many consultants that did the same thing, that taught the same way. Same report, same consultation. I could quote it from the book, Let's go knee to knee. Start to report a finding. We know what's caused your problem, and we can correct it. The problem is, can we? You know, how many people here, when correction means you might never need care? What we do is we work on controlling and containing and understanding that if Tiger Woods had 5 back operations, what's the normal success of back surgery? Well, that's where it starts to get scary, because if you read the research by De Palma and Rothman, both professors of orthopedic surgery. So who's this? De Palma and Rothman. And what do they say? They say many of these patients are subject to numerous operations, and after each operation, the patient is worse. That's pretty wild. So, matter of fact, it's kind of like Lay's potato chips. I bet you can't eat one, but when it comes to back surgery, I bet you can't have one. I mean, Tiger's on his 5th back. And listen, you know, they say, oh, but he's a golfer. But hold on. Yes, he is, but he's also worth over $100 million. He could go to the best doctors in the world. And then I love patients when they say, oh, so-and-so's only 80% better. Well, you know, hey, that's better than being 50% worse. You know, results, you see, when I look at this poster, which I was raised on in chiropractic, listen, I started as a straight chiropractor. You know, when I went to chiropractic school and I graduated in 1978, you were either a straight or a mixer. A mixer was somebody that used modalities. Now, I'm going to tell you, I started out as a straight chiropractor. The problem is when I started taking care of professional athletes and they had a sprained ankle, try to do a lay lecture that, oh, I'm going to adjust your neck and that's going to fix your ankle. I remember the coach brings in one of his players from the Miami Heat. The coach was Kevin Lockery and Alvin Gentry, and I'm there with Billy Cunningham, one of the owners, and they bring in Ronnie Cycli, and he has a sprained ankle. And they say, well, what are you going to do for the ankle? Well, you know what? Pretty soon, I put some EMS on the ankle, and I taped the ankle, and I did all the things that we can do as doctors, because what I learned, doctors, is why limit the scope of your practice? Meaning, I have doctors with 12 decompression tables. I think, Mark, just shake your head, I think you're up to 4 now? 3? And you know, 3, and you know, Mark's the type of guy, why he drinks his soup, he has 3, but he's thinking of 4. If you have 1 table, okay, then what you're doing is it's like doing the hokey pokey. I'll put the right foot in, I'll take the right foot out, I'll do the hokey pokey, and I'll turn all about, do the hokey pokey. You see, if you went to Annapolis and you go through your whole plebe year, you have to go to the high dive board, which I think is 100 feet, and you have to jump. And if you're not willing to jump, then you cannot move forward to your next year. If fear freezes you, they stop you right there. Meaning, hold on, you're going to tell me I have to go through a whole year of abuse because I didn't jump off a diving board? I cannot go on to my 2nd year? That's right. You know, what we do is I have so many doctors that have attended more than 1 boot camp, and we talk about a few things. We talk about spinal surgery. We talk about the knowledge of the disc. Barry, can we go back 1 slide? See, what I like about this is if you look at the near normal, let's move it. Then you have the 1st generation, the 2nd phase of generation. But let's just start with the 2nd phase of generation. It says some decay, but you see what they're doing is they're just discussing bone. All we did is talk about a subluxation. At National University, when I did the national certification there, they no longer wanted me to use the word subluxation. They wanted me to use the word kinesiopathology. And I got in trouble because, listen, I say subluxation. I've been raised on subluxation. My uncle graduated school in 1920, right? You know, when I have a fight with my wife, I say, honey, you're subluxated. That's how I was raised on chiropractic. It's never her fault. It's the subluxation that causes all the problems in the universe. The point is, what I try to say is, we always dealt with bone, but you know what? There's more, because basically we're dealing with bone, nerve, and muscle, okay? And as there is decay, okay, we can see if we look at the normal from phase 1 to phase 3, look at the differences in disc space. So could I look at an x-ray and tell the patient that they had a problem? Without a doubt. Scott Banks could do it. Marco Sergio could do it. Even you, Laurie Christian, you could do it. But the point is, why do I like an MRI? Because an MRI brings in a second opinion. Listen, due to the Marksons, the Singers, all of these guys, what they taught you was to be salesmen. We don't. We coach our players to be better doctors. We coach our players to understand the difference between kinesiopathology, myopathology, neuropathophysiology, and histology, which is why so many of our doctors now are doing neuropathy, which we brought in. Now we're trying to bring knees in with the help of Marco Sergio, who's done a great job. Okay, now we know that there is a viable market for knees because people don't want a hip replacement. They don't want a knee replacement. They don't want a lumbar replacement. And I could show you so many films of other chiropractors that have had back surgery. It would scare the heck out of you. And you know what, Perry, when we do the next Zoom meeting, we're going to show some pictures of what the surgeries do to people. See, and that's what happens in a report of findings. Listen, a sale is always made. When you sit down to review it with the patient, and Richard, I'm going to go strong on you next week, because I'm starting to be able to pronounce your last name, so this Patiti. See, how'd I do? Did I do it Patiti? Did I say it right? See, that took work in itself. I was like, people study, I don't have to study this anymore. I have to study name. Patiti, Lesagio, God almighty. You know what? You guys should love the research by Macario and Pergolesi. These are the names of Macario, Pergolesi. Who are they? Macario was from Stanford. Pergolesi was from Johns Hopkins. And they were in the World Institute of Pain, and they were published in volume 6 of the World Institute of Pain. And what did they talk about? The systemic literature of how decompression helps. Now, if we start with the subluxation, because what we teach is a subluxation is progressive. Perry, go back 3 slides, and then we'll go to this slide. Right there. See, here we have, and look at phase 1. We have a loss of cervical curve. Now look at 2. We have histopathology. Histopathology means the disc is already being chewed at. It's being chewed upon. By the time you get to phase 3, there's fusion. And that's why, and then you can tell somebody, they come in with a phase 2 or phase 3, you're going to correct them? How? What, are you going to open up the bone? We don't correct. We control and we contain. And then look at phase 4. And I used to tell them all the time, oh, you're in phase 1. You don't want to be in 2. You don't want to be in 3 and 4. But you know what? We get a lot of 2s. We get a lot of 3s. We get a lot of 4s. I mean, listen, do you realize that 6.5 million people are in bed daily with low back pain? Did you hear that number? 6.5 million. 5.4 million become disabled. It's one of the leading causes of disability in the country. Okay, now watch what happens. We know now by Cheng Ha Su, right? See the names I got to learn? Patiti, Macario, Pergolesi, Lesagio. I mean, listen, my head, let me go into the black, hold on. Let me go to the 8 ball. The 8 ball, I asked the 8 ball, what's the future of chiropractic? And do you know what it says? It says you better start bringing cash into your practice. That's what the magic 8 ball said. You better learn how not to be dependent on insurance companies. Now, what if a person calls your office and they say, do you accept insurance? It's a very simple answer. Yes. Because until you know what a diagnosis is, until you know what the prognosis is, listen, do we accept insurance? Yes. Now they come in and let's say they need decompression. Here's your first golden nugget. Okay. Now they say, well, guess what? We accept insurance, but unfortunately, your insurance is very limited. You don't have the best plan. Now, if you think I'm exaggerating, we take care of pro golfers, right? They have a plan that covers everything. People that have Blue Cross Blue Shield in the state of Florida, $25. I mean, as you move to the major states, California, $26. New Jersey still has decent insurance, but guess what? That will change, and I'll tell you why. No different than we're having a Zoom meeting now talking about how to help patients. If I'm in the insurance business, they're having Zoom meetings on how to save money. And when they look at places like The Joint that takes $19 for a visit, Why should they pay you, Marco Sagio, 50? Why should they pay you 60? Why should they pay you, Scott Banks, 70? So you have to learn, yes, we take insurance. Unfortunately, your insurance is limited, but we'll accept a little to pay us, and you'll owe us the difference. See, what you have to understand, if you looked at the Bogduck and Burton study, in the Bogduck and Burton study, it says the damage occurs before the pain is revealed. Ah, the damage occurs. So I love when people say, oh, they came in, they didn't have pain. Listen, do you treat the symptoms or do you treat the cause? The Bogduck and Burton, both medical doctors, they're not from Sherman, they're not from Life, they're not from Parker, they're not from National. You know, Bogduck is the damage occurs long before pain. And initially, it was Bogduck who said, because they used to think it was always muscular. Why? Because people that have back pain, they go into spasm. It was Bogduck who determined that no, it's coming from the spine and the disc itself. I mean, listen, if you take a disc, okay, and you impinge that disc, can they see that, Perry? Because am I on the big screen? If they see that,
yep.
Are they seeing that?
Yeah,
listen, when that disc bulges out like that and it starts sitting against the nerve, okay, that's going to create pain. I mean, do you know, listen to this, doctors, what is non-surgical decompression? Okay, so, and I'll follow the slides and I'll end stuff. Basically, you want spinal distraction without muscular contraction. So what does that mean? Well, Jacobson did a study, okay, and in Jacobson's study, they found that oftentimes traction increases interdiscal pressure. Spinal decompression is an event. The table is a conduit, meaning, you know, you as a chiropractor, okay, you remove subluxations by utilizing an adjustment. Now, I guarantee if I went around the room, so many of you use different techniques. But the point is, are you successful? And to me, to create the event, you have to get negative disc pressure. Now, that was further studied by Dr. Dyer. So Jacobson showed negative disc pressure. Then you have Ramos and Martin showed great. How did they do this? They did this utilizing transducers. I mean, this was actually measured. Ironman went on to do this as well. An event is created when you get spinal distraction without muscular distraction. One of the first chiropractors actually that did work on this was Dr. Cox. And he's probably the most published. And people don't realize before the decompression table, I don't know what that is, Perry. It's not me. Please mute yourself, whoever the heck you are.
It's called an immunity.
I'm not dancing on this one. Don't give me that music. Anyway, when you understand the research, doctor.
And like the juices and things like that.
Hey, whoever's unmuted, mute yourself, damn it. We're very busy here. You know who that is, Perry?
No, I don't know. But keep going. It's okay.
I'll de-zoom him. I'll zoom him out. If I can zoom out, I feel like Scotty. Zoom in, zoom them out, Scotty. Where we have to get to is understanding that when it comes to the disc, it's the inner layers of the disc that go first. Meaning, to get an angular tear, it starts on the inside by interdiscal pressure, and it works its way out. It's a female voice.
My fiance has COVID. Did you kiss him over the weekend? She goes, of course. And I go, well, I'm sure you have it too.
Shut up, damn it.
She called me and she was like, I'm sick.
Anyway, I'm going to ignore them.
Yeah, just go over. It's all right.
I'm going to ignore them because I can speak louder. I can speak louder.
Got it.
Why do you speak louder? Because I can.
Okay. All right. Talk later.
Spinal decompression event, much different from traction and much different. Why does an inversion work? I love people that would come into the office and they want to use an inversion system. Inversion doesn't work because what you're doing is it actually increases disc pressure, and it's actually a way they can herniate the disc. You take the lumbar spine, right? And you're in a certain position. Now turn it around, and now you're putting all the weight of your lower body, and you're putting it right on that disc, and you're turning the angle, and you have no control. You're increasing, good boy, Mark, you're increasing the intradiscal pressure. Now, the most prevalent cause of back pain is the disruption of normal kinetic function. It's the way it works. A person utilizes various ranges of motions. The discs, as you know, deform as a result of pressure within this space. So now that we know we have negative pressure, we have positive pressure. Inversion increases this pressure. Now, if you want to learn the basics of this pressure, because you should be able to explain this to the patient, you want to go into the chart, okay, that was done by Jacobson. And you'll notice that right now, most people sitting, well, guess what? You're probably at a positive disc pressure of 75 to 100 millimeters mercury. Now, where do you think the lowest disc pressure is? It's when you are supine, not prone. The vaccine originally started out in the prone position. And why they reversed it, the one who did that was Shealy. And one of the biggest studies on the difference between that and traction between the Nagelson study, the Ramos-Martin study, was the Shealy and Bergmeyer study. So when I'm sitting with a patient, doctors, you have to understand, and they have a disc lesion, you have to paint the picture of their future. Where are they going with this disc lesion? Will it get like a tooth? Oh, my tooth hurts. And you go to the dentist. What now, doctor, my tooth hurts. And he looks in your mouth and he says, you have a cavity and you need a root canal. Now, do you think the patient at that point starts negotiating? Well, how much is that going to be? Are you sure that I need it? I don't know. Does my insurance cover it? I don't know if I want it. Are you kidding me? Let me tell you something. It will not go. You have to look the patient in the eye. Let me give you the facts of life. It will not get better on their own. That as the annulus continues to tear from the inside, when you get an annular tear, a subluxation will become a bulge and a bulge will become a herniation. Meaning, if I get them in a bulge category, I say, you know, thank God we got this as a bulge before this thing herniated. You know, because it means that the annulus is still trying to hold that disc in. Once you have an annular tear, you have a herniation. I mean, people don't even know that. If you see on your MRI report, annular tear, you have a herniation. Otherwise, why did it tear? What do you think a hernia is? I tell people, very similar to a hernia. Instead of the muscle bulging out, the disc is bulging out. And if you had a hernia, what would you have to do? I would have to have surgery. Well, guess what? You're not going to need surgery at this point because we feel very confident. You have to be able to tell people things that they understand. Like three facts. Fact number one, spinal decompression is a specialty in chiropractic. And my doctors, when I say my doctors, you know, that's my arrogance, you know, because at this Centers of America, we believe that our doctors, okay, are the most adroit and sophisticated understanding disc. Why? We make them study. Why? Because we want them to be better than they are. Why? Because this is the game. Do you realize, doctors, that 75% of all medications produced in the world, okay, are consumed by the United States? 75% of all drugs consumed in the world are consumed by Americans. Now, where does that come from? The National Institute of Health. Not from Sherman College, not from the National Institute of Health. And don't ever hesitate to say, what percent of drugs that you're taking? What drugs are you taking? And then you have to know the side effects of drugs because you have almost 100,000 hospitalizations a year due to people utilizing too much, you know, non-steroidal anti-inflammatory drugs. We even know that Tylenol mixed with alcohol can develop liver failure. And yet people reach for those drugs before they'll reach for their checkbook to pay you. So you better have the charts and the summaries, okay, that we do it. DISC, okay, D-I-S-C, okay, doctors, it's smart. Doctors, it's smart control. It's smart chiropractors. So this now stands for doctors, it's smart chiropractic. Not to be, took me time to get that one, Perry. Not to be in smart chiropractic or specialized doctors, it's specialized chiropractic. And that smart chiropractic is to be specialized. Do you realize I do this at one of the events, and we'll talk about the event more because the event is probably one of the most glorious days that we have. It's held, you know, on the property of Trump in Florida. Now people say, well, what's so special about that? Well, to join it costs $100,000 to drive through the gate. I think that's special. And you get to come as a guest of myself and Dr. Barr to drive through that gate that other people have to pay $100,000 to do. That's where Donald's son owns his home. This is a very private place, and we do that to show you the magic of what you can do, the magic of transformation, because it was originally a Ritz-Carlton. And where Rich was not successful, okay, Trump has made it very simple. And this is not about politics. And I know there's politics out there, Republicans, Democrats. Let me explain to you something, doctors. When someone comes to my office, I don't care if they're white or black. I don't care if they're Asian, or Latin, or white Anglo-Saxon. I don't care if they're Republican or Democrat. I care if they're cash or check. So to judge anybody based upon policies, you know, then that's not acceptable in my world. Because we as a doctor, you see, and that's what happens. How many times does a person come into your office, and you know what you do, doctors? You pre-decide whether they can afford you or not. Well, that's what a salesman does. My statement is, I go right to the problem. You have a herniated disc, and this is what you need to do. And if you don't do it, let me tell you your future. And then right in front of the patient, I take out the magic 8-ball, and I shake it, and I said, oh, what does it say? If you don't get decompression, you're going to need surgery. Now, I don't really need the magic 8-ball to tell them that. But you know what? If you're on the ball and you know the research study, if you know the Bagduck study, the Martin study, okay, and you know, the Burton study, and what about the Burton MXL study? Because now that we know that the disc is live material and it does have the ability, the Boxell study shows that it does have the ability to regenerate. Spinal decompression allows you to use technology to treat spinal disc, non-invasively as a specialized chiropractor. Disc. Doctors, it's specialized chiropractic. And you have a chance to do this. Matter of fact, and then where is the disc weakest? Inflection. Who did that? McGill. So we know where the most injuries happen, when the patient is in flexion. Not extension, flexion. And that's why when you see some of these decompression tables, where all of a sudden what they do is they start like maneuvering the body versus using a fixed tower, okay, to control the angle. When you start putting that person in flexion and extension, what you're doing is you're moving the spine. So if you have to lift the table, guess what? Okay? And that's why sometimes, even when people have a Leander table, well, guess what? Not always is it good to put the person in a point of flexion, because we know the disc is already weakened. In a good machine, you'll have a fixed tower which draws an angle, okay, that helps you by percentage to do that. Now, not all tables are the same, but I mean, you know, there are tables based upon a lot of research. Before I'd ever buy a table, I would say to the person, show me the research studies associated with the table. Because I'll show you research studies on back surgery. I'll show you the De Palma and Rothman study. Okay, we can go on and on. Okay, what about, you know, surgery? What are the risks? Infection, scars, success rate. Back surgery now, first time, 40 to 60%. Would you be happy having a patient 40, 60%, and then you call me up and say they're only doing 80% better? Do you know that one of the reasons, okay, it's a statistical fact that the people that come off of back surgery have a 21% greater chance of becoming addicted to opioid medication? Because we now know that if you take opioids for like a week or 2 weeks straight, then the body has trouble, okay, getting off of that drug. So what it does is you'll get what we call phantom pain. It'll increase the pain because the body wants the drug. Remember, the power that creates the body is the power to heal the body. So, okay, so look at the one tables, okay? If you notice the table on the left, okay, that's an Acuspina, and I like that table. The next table is a DRX. I actually don't mind it because both of those tables are using fixed towers, and you can see the band, okay? Now, the old table, that was where VaxD started. Now, the reason that they changed was two reasons. One, when Dr. Shealy was doing research with it, with Dr. Dyer, he dislocated his shoulders. Then they started realizing that at that position, in a prone position, the back has 75% increase this pressure. And that's why when people have back pain, okay, you want them on their back with their knees bent, which shows on the axiom and that. Now, when I look at the bottom left picture, okay, listen, to me, that's a problem because you're already altering the angle of the spine. So how do you know what direction you're pulling at? The person, look at them, their legs are up, so they're almost a little bit in a little bit of extension, okay, and it's putting pressure right on that lumbar spine. It's almost taking the effect of inversion, okay? And then you look at the next table in the bottom right, okay? Now what that does, it's actually closer to what Acme is trying to do, what DRX is trying to do. The problem is, okay, if you look at the rope winch, it's not a fixed tower, so it's more again of a traction device. And then if you look at the bottom right table, okay, now you're bringing the body upward, okay? So when you do that, look at the pressure you're putting on that lumbar spine. See, if you want to get spinal distraction without muscular contraction, okay, what you want to do is the purpose of that is you want to fool the body. Once you start to trigger the Golgi tendon reflex, doctors, you're in trouble. That this deformation is caused by where there's nuclear migration and elongation of annular fibers. The intervertebral disc, doctors, is a mechanical structure. It's just what it is. It's devoid of basic vascular nerve supply. Yet, doctors, I hope you know this, it consists of 86 to 87% of water, similar to the body. The intervertebral disc, okay, and what we know is over the years, Jacobson conducted many extensive studies that showed that the discogenic injury is usually complicated, which is associated with physical displacement. It's associated with edema. Edema. Why? Well, what does edema do? Edema is swelling. And if you have swelling, what does that do? It puts furthermore pressure on that intervertebral disc space. So you have to say, so what do we do for swelling? That's why we like lasers. Now, I'm not in the laser business. I guarantee you that at least probably 80% of the people that are on this call have a laser. I don't sell lasers, but I do know that there are 4 grades of laser. And I do know that laser helps reduce inflammation because it's like a magnet of blood. It increases the ADP. And you have to know this. And because when I'm explaining to the patient, I'm going to say, listen, first we have to deal with the histopathology. Then we have to deal with the inflammation. And I tell people all the time, if you got your finger, okay, caught in the door, and I took the door off your finger, would all the pain go away? Of course not. Because what happens is, once that you realize that you can get the pain away, you still got to reduce that inflammation because the edema is a pooling. That's why one of the, we like electroanalgesia because what it does, it creates an innate nerve block. We like laser. Technology, doctors, listen, I just got a new phone, right? What do I have now, Perry? I guess it's like the Apple 12 now. What am I, at 12, right? How many people still have an Apple 1? How many people have an Apple 2? How many people have an Apple 4? That shows you, all right? How many people have an Apple 6? People like technology. And by bringing technology in your office, our thing at This Sense America, basically our mantra is, This Sense America, where touch and technology come together. That's what we do. We bring touch and technology together, utilizing and understanding that a lot of the experiences of what you have to do to create it. Now, listen, I'm very grateful, for so many people in this profession, when they went to the Sid Williams and you have James Parker and, that started doing it. And then David Singer, and you had so many people that came out there and taught us how to educate people on chiropractic. Because without understanding chiropractic, you can't handle discs. But you know what? What is decompression? It's specialized chiropractic. Meaning, if you look at a chiropractor, what's the initials after his name? DC. Now, if I was a gastroenterologist, what would the initials be after my name? MD. If I was an orthopedic surgeon, what would the names be at the end of my name? MD. If I was a cardiologist, what would the initials be at the MD? So when they ask a guy, what kind of doctor are you? Does he say MD or does he say, oh, I'm a cardiologist? Oh, I'm an internist. Oh, I'm a GI. When they ask me what kind of doctor I am a disc doctor. Listen, I'm the real double D, baby. I'm double D. Here I am, this doctor. I'm coming out. You know, that's what I do. And that's what I want you to do, is to understand that we can do this. I mean, do you realize, Doc, watch this. I'm going to give you some amazing statistics that are going to blow you away. Mayo Clinic on statistics. 7 out of 10 Americans take prescription drugs. 7 out of 10 Americans. The average 40-year-old takes 4 different prescriptions. Persons 65 to 69 take an average of 15 prescription medications. Now, so don't tell me when a Medicare person comes in, oh, I got new patients, but they're only Medicare. Medicare people probably have more money in the bank than the 25-year-olds and the 35-year-olds. They got money in the bank. Don't leave it to the grandkids. Have them leave a little bit to you. Because you know what? That's where the word yet comes in. And we teach the word yet. Yet. Do you have pain down your legs? Yet. Do you have incontinence? Yet. Have you had drop foot? Yet. I mean, because let me tell you something. You occlude those nerves. I will show you. It's a shame. You know, I said, I have a picture of a chiropractor who just had it because after the surgery, he went and he started becoming antalgia. So he started getting a bend. Now we know that one of the major causes of death in seniors, okay, are falls, which is why we bring in neuropathy. Neuropathy is the sister of decompression. Give you an example. If somebody came into me and they had sciatica, right? That's pain down the leg, automatically I would say, oh, it's sciatica. But if you look at the symptoms of neuropathy, pins and needles down the leg could also be neuropathy. So could a person that, and how would you know how? Because there's technology that we recommend and utilize that does balance testing, okay? And we balance test them. Takes 5 minutes. See, what you need to do is, you know, we did a national certification program. We just did at Life University. We had 150 doctors, but hold on, more important, we had a $50 doctor waiting list. Imagine a chiropractic seminar having 50 doctors. And why? I'm not about sales, doctors, okay? You all know how to sell. You wouldn't be on this call if you didn't do it. And you went to other coaches and consultants during the game. And that's good, but you know what? It's time for Coaching 12. That's what we are. We're like Apple. We're taking coaching to the next level. We're basing it on medical research. We're utilizing technologies that are medically oriented and medically driven. And we go from the European Musculoskeletal, the American Journal of Pain Management, okay? All of these and more have been out there. We'll talk about the Ironman study, the Bogdack study, the Boxell study. These are all, you know, the Shealy study. Why do I say Shealy over again? Well, heck, he has over 500 published papers. He graduated from Duke Medical School. He taught at Harvard Medical School. If you don't think that's impressive, let me tell you, to the average person it is. That's the history. This was developed by the Minister of Healthcare of the country of Canada, Dr. Alan Dyer, who was an MD, not a chiropractor. I tell people right out of the gate, this is not a chiropractic modality. This was developed by the Minister of Healthcare, who also, by the way, developed the defibrillator. He developed the defibrillator, for God's sakes. Okay, and Shealy was involved he developed the TENS unit. I'm dealing with two of the greatest doctors, and that they both embraced me, that I've been able to speak to Dr. Shealy and Dr. Dyer, and we're getting ready to do another research program with Dr. Dyer, with Dr. Shealy, with this set of American doctors. It'll probably be one of the largest studies. One of the largest studies before that was the Nagazuski study, which had 740 or 50. Now that was large. Next to that, one of the largest was the McClure study. Dr. Dennis McClure, a neurosurgeon, utilizing the active-spinal table, utilizing IVD therapy, okay, he had I think it was like 464 people, just under 500, but he had a 91 to 92% success rate. Even above 86 to 88% after a year. After a year. Okay? Now, you know, Dr. Dyer, they did it. They used research, and you can see what they did is they used transducers, and they were able to go in and actually measure the disc pressure. This is a science, doctors. This is, you know, he took the work to a higher level. And you can see what he did is eventually he moved it to a supine position. And look again, the knees bent. Why? Because without decompression, the lowest level of disc pressure is going to be when you're supine. It's 25 millimeters mercury. Those are the numbers. I know the numbers. You can look them up. Go get off the thing. Go into your thing and look up Nagelson's study, and they'll show you what they're doing when they're standing, when they're sitting, when they're bending, when they're lifting. All those things put pressure on a disc. Your job, doctors, is when they come to you, okay, is do it. 83%, Mark, write this down. 83% of all back injuries happen bending, standing, bent forward, sitting, and slumped. 83%. So what does that tell you? Bending, sitting. Dr. Shilley, okay, who's a North American neurosurgeon, okay, I mean, this is from Wikipedia, doctors. You can't make this stuff up, and I'm honored that we're going to be doing a research study with them, and I got to move quickly on this, you know, because, I mean, listen, it's a strange world we live in. And let me tell you something. The pandemic will resolve itself, whether it be through a vaccine, whether it be through, you know, antigens. But let me tell you something, doctors. There is no cure for back pain. We have chiropractors have had 100 years since, you know, we can go back to the very beginning, okay, to Harvey Lilly, okay? People still have back pain. And you can't say, oh, it's only for the people that never got chiropractic. I've had chiropractic, and I'll show you my MRI. Why? Chiropractors are the running backs of professionals. We're getting, you know, listen, you see people, you're bending over, you're lifting, you're bending. I mean, think about the motion, doctor. We have to stand up now, and now I have to help the patient up. What position is my back in? Look at me right now. Oh my God, I'm in flexion. Now I gotta lift this son of a bitch, and he's not, and he only wants me to take his insurance, it's 100% payment. No, I'm not risking my life for you. No, it's not gonna happen. What I'm saying, doctors, is here we are in flexion all day long. Imagine when I was seeing 200 people a day, right? I'd come home and I'd say, honey, I'm home. And she says, stand up straight. I'd say, I am. This is as straight as I can be. 100 people. This is, oh God, I gotta, oh God, where's Perry? I would say, where's Perry? I need help now. Where's Perry? Where? Oh, hold on. And I told you, I recently had a doctor who, he got locked in that antalgic forward flexion, and they had to try to boost him. He had to have 2 surgeries. And one day they had to go in anteriorly, and the other day they had to go posterior. If I show you the amount of metal in his back, I have less metal in my golf bag. And I have 14 clubs. That's the legal amount. I have 14 clubs. There's less metal in my golf bag. See, doctors, it's making a seniors, 80 to 84-year-olds, okay, according to Mayo, and take 18 prescriptions a day. Bulging a herniated disc is one of the reasons why they do that. Okay, so your conditioned tears allow the disc material to push the annulus out against the nerve. So you can see, watch what you have. Normal disc is to the left. Okay, bulge is the next one, because as the annulus starts to stretch out, and oh, once you tear it, see, look at how those annular fibers have now torn. Now you got to help open up the disc space. So what you need to do is to fix the pump, okay? Because the pump helps create imbibition. And imbibition is what's going to bring the nutrients in. Now remember, the Boxell and Martin studies, MDs say that the disc, it can heal itself, providing that you help increase the pump mechanism. Disc injuries have one thing in common. They have lost their innate ability to keep itself hydrated. You see, listen, whether you do decompression, whether you do chiropractic, whether you do stem cells, the bottom line is the power that creates the body has the power to heal the body. All you're trying to do is induce it. Now, I love the people where they say, oh, well, 26 visits or 24 visits, a lot of visits. But hold on, that same person will go get on an antibiotic, and they'll take the antibiotic 3 times a day for 10 days. And you know what I said to him? You just had 30 visits. You took 30 chances of having an adverse reaction to a drug. 30 chances. If you had a broken bone is going to take 6 to 8 weeks to heal. Why would you, as a chiropractor, think that you can heal people in less time than what it takes? The body takes time. And you have to understand, you know, from kinesiopathology, neuropathology, myopathology, histopathology. What if I tell you, let me tell you something, that's 80% of your practice. I mean, you're dealing with muscle problems, you're dealing with nerve problems. If you don't understand that, back pain affects 80% of Americans at some point in their lives. Lower back pain is the most common disability among people. Watch this, under 45. This problem's are not old people. And you want the footnotes? They're all right there for you. I'm giving you gifts. I'm giving you gifts like you've never seen before. Okay? Do you realize that when it comes to peripheral neuropathy, 22 million people suffer from peripheral neuropathy? That's 1 out of 5 people. So what does that tell you, Lesagio? 1 out of 5 people in your office has neuropathy. And if you don't know how to diagnose it, you don't know how to educate it, then what are you in this business for? Right? Everybody looks for the magic ad. Oh, what's the new ad? Let me tell you something. It's not the new ad. It's a new program. Our goal is to make people better doctors, to understand the difference between kinesiopathology, histopathology, myopathology, and know how to treat them. How do you treat the bone, the nerve, the muscle? Okay, how do you treat the disc? And that's where it comes in. Okay, do you people know that spinal surgery is the second leading surgery in America? Are you kidding me? Second leading surgery. What's the cost? 6,000 to 8,000, up to 60,000, 85. You can look up the John Hopkins studies. Okay, you can look at the Newsweek studies. Okay, and then what they don't tell you is now the person says, oh, my insurance might cover the surgery. Yeah, but what about when you're out of work for 3 months? What about the physical therapy? What about the medication? Nobody gets 100% of copayment. But you as a doctor have to explain that to the patient. See, when a patient comes to me, here's what I believe, and I talk about this at boot camp. Nobody comes into your office and fills out the paperwork and tells you like, yeah, I had herpes simplex #1. My father died of heart disease. My mother has diabetes. Okay. Oh, yeah, I've had a history of yeast infections. And I'm not being sarcastic. Nobody comes in and does all of that and writes it all down on paper. And then they meet with you and you do an examination. And then they let you even x-ray them. And then they say, oh, I'm going to talk to my wife. Oh, I got to think about it. A sale is made in every patient encounter. Either the patient buys what you're selling or you buy their excuse. What's the truth? Some studies show a failure rate, okay, as high as 50% of back surgery. Now, we also know that failed back surgery leads to opioid addiction. For single level spinal fusion, single level, as few as 40% of the patients obtain significant pain relief. And if you look at some of the studies, 70% go up to having back pain 4 years later. So surgery is not the answer. As I said, Tiger Woods just went for his 5th operation. 5. Go back to that one, Perry, please. I was enjoying that. Microdiscectomy, the overall success rate. Now remember, they start with a microdiscectomy, 74%. Now, what did they say by overall success rate? That means that the patient's out of pain at that moment. The problem is when I spoke to Rob Burke, neuroradiology, he said, the problem is, for any healing to take place, the body produces fibroblasts, and that's fibrosis, which we know is scar tissue. Well, when you have all that complex in that low back or all those nerves, and you start to grow scar tissue in there, what happens is if that scar tissue happens to catch that nerve, listen, there's no way that they either have to do another surgery or they're going right to opioids. Work comp patients report a success rate of only 29%. And you know what's amazing? You want to know, listen, you want to know how it is? You as chiropractors in most states now can't even get work comp care. That's how they think of you. I'm Rosa Parks, baby. Don't tell me I got to sit in the back of the bus. I'm not. I just refuse to do it. I'm going to drive the damn bus. More than 1 million Americans undergo back surgery yearly. That's double most developed countries and 5 times out of the United Kingdom. That doesn't scare you? A 2008 article in Newsweek chronicled the story of Seattle President Bruce Wilson, endured 7 back surgeries and it cost $278,000. I was with a guy, Trump, recently. He's had 10 back surgeries. It's like every 2 years he has to go back for another surgery. Why? Because of the scar tissue. And we know a team of physicians such a prestigious, this is Macario and Pergolesi. Patients who went on surgical spinal patients experienced an average of 74% decrease in pain. Patients also experienced. Now, Timothy Kremchek, I've had the ability to talk to Dr. Kremchek. Dr. Kremchek not only did he talk about it, you can go on my son's app. Okay, matter of fact, go on his website, which is, write this down, wellingtondisccenter.com. All right, and you can watch Dr. Kremchek, okay, and Barry Larkin. Barry Larkin's a Hall of Fame baseball player who my son treated, okay, and Dr. Kremchek talks about, in the beginning of this thing, I had back surgery. Now, this is something that we give, we can have that. We give it to our clients. Not to have it on your website is crazy. So I have one of the leading orthopedic surgeons. How big is his office? 100,000 square feet. Tiger Woods' arrest and pain led to meds. Steve Kerr, coach of the San Francisco Warriors, couldn't sit for a year. Urges people out for anything, rehab, anything over back surgery. I mean, we can go on and on. Jeff Overton, who I spoke with on the golf course, a little back, hasn't been on the tour yet. Why? Because he went for epidurals, which, by the way, we talk about this in detail. They are not FDA approved for back pain. That's considered off-label usage. Okay, he's still not back on the tour. And what about John Hurd? Okay, for his role as Peter McAllister in the movie Home Alone, died. He was 72 years old. Who did the operation? It was done at Stanford. So you can't get a better hospital. I love this one. Perry knows I used to say some practice. The difference between major surgery and minor surgery is minor surgery happens to somebody else. So you see, doctors, these are the things that you have to decide. I mean, when people come in, trust me, what is their alternative to you? See, it's either, there's the old expression my father used to say, it's my way or the highway. He'll say, don't give me reasons, give me results. Okay? And what we do is we talk about that. And you have to let them know, see, listen, the alternative to decompression is surgery. And surgery, unfortunately, if you look up the statistics, and we'll give it this. I mean, here, failed surgery outcome. Okay? Failed back surgery is not only frustrating, but can be devastating. Why? It leads to other areas. I told you, a 21% greater chance of having, opioid addiction. Addiction is a big word. Okay? And then you have, look how the screws break off. So one person sent me a picture that looked just similar to this. And I said, oh, can I do decompression on someone with hardware? No! All right, let's say that again. Dr. Kaplan, can I do decompression with someone with hardware? No! Why would you ask me that 20 times? Because you want the money. There are other technologies that you can utilize. Why? Because it's already implanted in. So if I go into that thing and I start to pull it now, could I break a screw? Yes! So let's go through this. Dr. Kaplan, if I have metal on my back, is it contraindicated? Yes! Let me see what the 8-ball says. Can a chiropractor do decompression on a person that has metal in their back? Oh, look what it says. Only if they want a malpractice case. I love the magic 8-ball. You have to be able, that's why, doctors, in your bag of tricks, okay, do we have techniques like activator? Yes. Do we have techniques like SOT? Yes. You have to be able, we're not Ron Popeil. One size does not fit all. You have to be experienced. That's what we talk about. Let's look at this one. This is very big, okay? Everyone talks about Corona, right? Corona, COVID. Okay, let me tell you, one's a beer and one's a disease. Who the hell knows? Adverse drug reactions, 106,000 deaths annually at a cost of $12 billion. You want to reduce some of the deficit? Medical error, 98,000 deaths annually at a cost of $2 billion. Bed sores. You think Cuomo's screwing up? Listen, 115,000 deaths. That's for you, Scott Banks. 115,000 deaths, $55 billion for bed sores. Now, if you say, oh, who's the author of this? I'm giving you that too. I'm giving you the numbers in the author. Okay? I mean, unnecessary procedures, 37 at a cost of 122 billion. Surgery-related, 32,000. Look at the number, 282 billion. That's the estimated annual mortality economic cost of medical errors. So you know what? We need to not just focus on a virus. We need to focus on how we can help people avoid surgery, because surgery seems to be the problem here. And then we talk about epidurals, okay? And epidurals, are non with all invasive medical procedures. The potential risks are infection is very big. But again, the most important thing is it's not an FDA approved thing for back pain. And all of my clients, or if you're part of the International Disc Education Association, it's $179 a year to join. You get a big certificate, okay? You get all the stuff you want, okay? You can get the whole thing on the FDA. Now, if you want to learn more about the Chiro event, and as I said, and I'm going to turn this over to Dr. Bard in 1 second, the Chiro event we hold in Florida. And you know what? I mean, Richard, you can shake your head. Was that, Richard, one of the best events you ever had? One of the best mornings you've ever spent? And let me tell you something. Richard's not an easy guy. Don't think Richard did his homework. Richard, just keep shaking your head. Yes. Did you call 1 million doctors before you came down? You bet he did. And look at him smiling now, because now he's part of the family. And Richard, honestly, even from that, you're coming down for a boot camp soon, because of the time that you spent with myself and Dr. Bard, be honest with me. Do you see that yourself being a better doctor? And how good were the meatballs? Oh, mamma mia, right? The food. Listen, we put together a buffet that'll take your socks away. Look, you see Marco Sergio over there? Mark, when he first started with us, was 100 pounds. He was a 100-pound wrestler. Look at him now. Now we call him Luca Brazzi. So if you want to know about being family, if you want to know about the Cairo event, if you want to know how to take your practice next level, if you want to start being a pretender, if you want to start being really loving what you do, because I said this when I did the commencement address at New York Chiropractic College. When you're always chasing money, doctors, you're a slave. When you can teach money how to chase you, you're the master. And how do you do that? By being the best. Dr. Bard, take it away.
So take out a pen right now, and I want you to write a few things down. Number one, I want you to write this website down. I'm going to show you some very cool things now in terms of some things to think about that you can plug and play into your office right here, right now. And as we start to talk about this, what I want you to do is I want you to write this date down. It's March 6th. It's coming up in about 4 weeks, a little bit less than 4 weeks, actually. Go to the website. If you are interested in securing a seat, I do not know at this moment how many seats are left. I believe there are a few seats left. I kind of have a strange feeling, though, that after this webinar, Zoom meeting, it will be sold out. Why do I know that? Well, I know historically that's the way it's always been, where we do these Zoom meetings and then all of a sudden, then they have to start the waiting list. So if you want to kind of one up that, you can go to the website right now. You can try to secure a seat. If you get a little pop-up that says it's sold out, then they'll give you an option to be able to maybe come in the future to something else. When and where, I don't know. But what I would tell you is this, 888-990-9660 if you're interested in attending that. And but before we do that, I want to show you something here. Tell me if you could see this right here, right now. Can you see this? All right. So if you want, I want to talk, I could show you hundreds, and I mean hundreds of websites, but I want to show you a website of someone who's very near and very dear and very close to us, because I think it's a story about success. It's a story about someone who started with nothing when he started and built a multi-million-dollar practice in just a little bit over 3 years with his amazing wife. We're talking about Dr. Jason Kaplan. And if anybody knows anything about Dr. Jason, you know that he actually teaches the hands-on part of non-surgical spinal decompression certification program, which will be announced. It'll be at the end of the year. So if I'm you, I'm not waiting until November. I want content now. I want information now. I want plug and play stuff now. I want tools now. So let me give you something to think about right here, right now. If your website is not moving people to action, then there is a hole in the bucket. And I will show you the #1 way to help move them. The #1 way to move them is to be able to have something on your site that in essence is able to move them forward at their pace. Now, if you'll notice something, when you come to the site, what do you see? You see the branding of Dissenters of America. Best branding in the world, largest group, most real estate on the planet in non-surgical spinal decompression centers. When you do a search, I just did an email not that long ago, 12 pages deep. I sent that in an email. I said, do a search for Dissenters of America. It went 12 pages into Google. That's how much penetration we have. But I want to show you something powerful here. We talk about something called above the fold. I know that's a big internet term. Some of you heard it, some of you didn't. Above the fold simply means this. It means that I don't have to do anything when I look at this website. In other words, without having to scroll anywhere, if I simply hit one button, now watch this, if I hit one button, all of a sudden it's going to bring me to a form. It's going to bring me to an intake form, and we're going to gently, now watch this, if I fill out this form, let's say I'm a prospective patient, and I fill it out. And I've been to a chiropractor and before they tell me I have a disc herniation. My pain started 1 to 3 months ago, and I forget to fill it out completely. Watch what happens when I hit the next step. It won't let me go to the next page until I tell them what I've experienced. Now, there's a reason for this, and I'll prove it to you. The reason for this is because of the simple fact that what we found was this. We found that if a patient will fill out this form, and this is part of what's known as a drip system, an intake form, it is exclusive to Disc Centers of America. If you are a Disc Centers of America doctor and you do not have this on your website, you know who to contact. Contact the person who created the site. You know who it is. He's the best website builder for Disc Centers of America and more in the world. He's the most attentive, and he pays attention to things, the invisible, that most chiropractors have no clue about. This is how you drive bodies, traffic, people, patients into your front door, and it's awesome. Now, the same is true here. We fill it out, and again, you'll notice, have you had any surgeries? And if you don't fill it out, watch what happens. You can't get to the last page unless you fill it out. Now, here's a miraculous thing. What we found was the patients that filled this form out, when they presented in our Disc Centers of America doctors' offices, the doctors have over a 90% conversion rate. Imagine that, 90%, meaning 9 out of 10 will accept the package or the prescription for care that you advise, that you prescribe to the patient if they filled out this form first. These are the things we teach, we share, we show at the Chiro event. The Chiro event, if you've been fortunate enough to be there, you know I always share these words, and to me, it is the most profound thing because it's from my heart personally, in the sense out of all the things that we have ever done, Dr. Kaplan, myself, and any type of training we've ever given, any masterclass, any certification, any event, and they're all incredible. My favorite thing is the Chiro event, because the Chiro event is where we roll up our sleeves. We talk about how to get the phone to ring. We talk about how to shake the tree and get all the apples to fall. We talk about positioning. We talk about marketing. We talk about branding. We talk about examples. And what I love, love, love is I love to be able to show you example after example after example of what works. And that's one of the most incredible things about it. And if you hang out for a little bit longer, I'm going to show you a slide that will lock in everything and more that we're talking about here today. Yes, never shown before. Oh my gosh, OMG. I'm going to show you something that I know for a fact is the takeaway for today. Dr. K, can we go back to you for a little bit and you can talk a little bit more?
Yeah.
Maybe.
So, you know, the event is a life-changing thing, but you know, it's life-changing in the sense that, you know, again, you know, our philosophy is getting people up to snuff, you know, and you know, I go back again. I love research. So if you look at the Margolis, who was an MD PhD study, and they talk about, you know, the risks include infection, of course, of surgery, but here's what he said: fewer, okay, than 8%. I apologize. Fewer than 5%, okay, actually do need back surgery, you know. And then if you read, you know, Rahman's book, you know, Crooked, it talks about, you know, how they even like played in California by utilizing illegal screws, illegal devices. You know, nearly 1 of 50 back surgery patients also dies within 3 years. Now these are not this is not me. Here's the resource. And doctors, do it. That's the back surgery often related to analgesia. The death rate is high when analgesics are involved. The mortality rate increases 7-fold when cage devices are used. Dr. Eugene Karagi, MD at Stanford University, provides surgery only on a select group of patients whom he carefully screens. The conclusions. Listen to this. I will read every one slowly. Less than 25% will be completely successful, even after carefully screening them. Freeze. So if you want to know, when you're doing a report of findings, doctors, take this, okay, and take that one quote and hand it to the patients. Take the page, take a picture of it now, give it to them. For the majority of patients, Barry, can you go back one, please? For the majority of patients, the surgery does not have a dramatic impact on their pain or mobility, that the patient's prospect for a future free from back pain is very poor. Now, if they don't get that, doctors, obviously, you know, you did too much of the basic chiropractic report of findings. You know, this is not like, listen, you know, we're going to change your life and you're going to, you know, I'll be your chiropractor. You need 3 times a week. A study by Orthopedic Technology Review showed 219 patients with herniated degenerative disc. 86% showed improvement. Only 2% relapsed. Now, what study is this? This is the Shealy study. This is one of the Shealy studies. It could be, it's either the Shealy-Bergmeyer study or one of his other major studies. Now, the Mayo Clinic study, okay, this was done by a Dr. Leslie, okay, and, you know, basically average pain score was 6.4 to 10 for pain prior to treatment, okay? 20 treatments were given over 6 weeks, okay? And Leslie shows how over the period of time, how the pain decreased, okay? And, you know, I don't know if this was a Mayo Clinic study or it was a Dr. Leslie who was affiliated with the Mayo Clinic. You know, I don't know officially, but I do know where it was done, presented. Long-term results, 91% doctors resumed normal daily activities. Over 80% showed 50% or better pain reduction. Greater than 50% still at a pain level of 0. I mean, that's pretty remarkable. Now look at this 4 years. 4 years after spinal decompression, okay? They're still doing well. I mean, surgery, now they're on the 2nd, they're on the 3rd, they're on their 4th surgery. And listen, and didn't we try to teach people in chiropractic about maintenance? Well, what we teach at the boot camp is we talk about retention. Why? Because maintenance is a bad word. After braces, what do? You have a retainer. Now, the chart he's showing you here, again, this was done by Dr. Leslie, okay? This is the Leslie study who's affiliated with the Mayo Clinic, okay? And you can see week 1. So I love that people say, well, should I give them 1 free visit? Now, I know there are doctors that do that. I don't believe in that. You know, otherwise, why is a person, you want a commitment from them over a 6 to 8 week period of time? Now remember, that's average. I need longer than that. I need longer than that. Okay? What are some basic contraindications of spinal decompression? Osteoporosis, surgical appliances, advanced arthritis, disc fragmentation, pars defect, meaning greater than grade 1 spondylolisthesis, paralysis, fusion. What about leg drop? You know, of course. I mean, common sense. I mean, what conditions would be contraindicated to chiropractic? Positioning. Okay, we believe in the importance of the MRI, and to me, I like the MRI because the MRI gives me, you know, a second opinion right out of the gate. It's not just me telling the patient, oh, do you see this little piece of narrow disc space right here? No, I'm going to show, listen, this is your radiologist, and he's showing you have a problem. My job is we can help you with that problem. And let me tell you something, doctors, I'm going to tell you right now, you should all meet the neuroradiologist of the clinic that you're referring to. You send them enough business, meet him, okay? Get to know him, know the machine, know him. You know, why is that important? Because let me tell you something, we get a lot of referrals from the radiologists. I mean, we're the disc specialists in town. That's what you want to be, a disc specialist, okay? And that we know, you know, MRI supine, MRI weight bearing. Usually weight bearing is gonna create more. However, not every area has a weight bearing MRI machine. So you have to be able to work with what you do. You're moving fast on me, Perry. Robert Burke is a guy, I know Robert very well. I was just with him on the golf course actually on Saturday. And Robert was a guy who, you know, knew about back pain, and, you know, and we got Robert, and then when he saw me playing golf, he said, well, you know, who did your surgery? And I said, Rob, I didn't have surgery. And I said, decompression, let me tell you about it. You know, and he shook his head. Well, a few months later, he developed back pain. He said, Tell me, can you send me the white papers over on the decompression again? Now, what is white papers? Those are the research studies. Those are the studies that we talked about, the Boxell study, the Martin study, the Ironman study, the Ramos and Martin study, the Shilley-Bergmeyer studies. These are studies that you need to have, the Pergolesi studies, the Maccaro studies. These are studies, doctors, the Bogdoc studies. These are studies you have to have because that's what the medical doctors want to know. My son gets referrals in. Perry talked earlier on. He talked early on about, still in the game. Okay, I'm still in the game. I look at my son's numbers every day and every week. Now, I know last week alone, 1, 2, 3, 4, 5, he closed 6 decompression cases last week. I mean, that's pretty amazing. When you think about, here's a 34-year-old who understands disc, who understands, sciatica, who understands when it encroaches onto the cord, who understands stenosis. When people say is stenosis contraindicated, the answer is most times no, because stenosis is when you have a big herniation, it's encroaching into the cord. Okay? You want to open it up. No matter how you look at it, it's bad. X-rays, MRIs. I mean, to me, an MRI gives me a second opinion. Not only that, I want the neuroradiologist involved. I want to rule out that there's no growths and there's no tumors. I want those things, right? What do you want, doctors, and what price are you willing to pay? Okay, that's the question that you have to ask. Okay, basically, as I said earlier, a subluxation becomes a bulge, and a bulge becomes a herniation. But here's my question to you, doctors: how good a diagnostician are you? Do you do a Lesage test? Do you do a Bragger test? Do you do a Soto Hall test? What test? Take it over, Per.
So no, we're good. You know what I love about, I think my computer fell. There we go. I heard today probably more research studies that are new than I've heard probably in the past 2 years. And I don't know if you're staying up late at night. I don't know if you have your team worldwide digging in, as I know that you do, for learning the latest, greatest. But if you'll notice something, I know that if I'm on this training, these are the questions that I have. In other words, when you have a patient, how many discs do you pull? Which disc do you pull in terms of if there's one that's more involved than the other? What type of therapies do you use that are adjunct therapies that are the most complementary to non-surgical spinal decompression? Do you belt the patient? Do you give them a support? How many visits do they really need based upon their presentation? What's the best form of supportive rehab? What are the things that you include in the package? What do you charge? How do you create a retainer program? These are all the things that I know that if I was on the outside looking in, that I would want to learn. I would also want to learn, how do you bill for it? How do you code for it? Does insurance pay for it? Well, that depends. These are all open-ended questions that can be answered when you have an opportunity to learn more. Invest in yourself, doctors. Learn in terms of what you can do to bring a better package to the table, a better package to your practice. I want to learn from the guy who's basically in the deep end of the pool. I want to learn from, I was going to say Dr. Kaplan or someone like Dr. Kaplan, but let's be frank, there's no one like him. You could search far and wide. You're not going to find anyone like him. You're not going to find anyone that is the end all be all of that. And where do you get a chance to learn more of what you can do to bring a better package to your practice? You do it at the Cairo event. It is my favorite thing we've ever done. There is one coming up on March 6th. I don't know how many seats are left, but if I'm you and I'm watching this and I can tell you right now, I'm watching Mark Lesagio, and it was so funny because it's cold up in the Northeast. It's cold in the Midwest. It's cold. I just got back from Atlanta, Georgia yesterday. Yes, I was in Atlanta yesterday. And you know what the weather was in Atlanta in the morning? 31 degrees. So Why would I not want to come to South Florida in an exclusive training with entrepreneurial chiropractors to put my feet in the sand, to really get some great vitamin D from the source, but more importantly, to come away better? I want you to write this phone number down, 888-990-9660. If you get an opportunity to call that number, you can learn more about securing a seat there and about attending. And I wanted to show something here today that I've never shown before, ever. And the reason that I wanted to show you guys this is because it's that simple. What I wanted to show you was one picture, one slide, one thing that if I'm walking away from this and I'm watching and say, gee, what can I learn at the Chiro event that makes it different? In other words, how can I walk out different that day than when I walked in? And it really came down to one thing. The one thing is this: if you look at your business, because remember, let's be frank, this is a business meeting. This is a Zoom meeting. This is a business meeting. And if you want to talk about the big idea, if you look at how to monetize your practice, I know if I'm a chiropractor and I'm looking at all the things I do, non-surgical spinal decompression, neuropathy, joint care, personal injury, nutrition, you name it, and I have all these portals of entry to my practice, if there's one picture that sums it up, it is this. I don't know how well it's going to show. Fingers crossed. Let's see if it works. And there it is. This is your big idea forever and a day for the remaining days that you are in practice, doctor. And I hope it's a very long time, but more importantly, it's a time that you decide how long it is. Your practice is exactly this. You will take one brick, you'll put some cement down, and you'll put another brick on top, and you'll put some cement down, and you'll put another brick on top, and you'll put some cement down, and you'll put another brick on top. Each brick symbolizes how you can monetize your practice. Each brick could be non-surgical spinal decompression. It could be chiropractic. It could be personal injury. It could be neuropathy. It could be shoulder care. It could be knee care. It could be laser care. These are the things that you have an opportunity to learn more about at the Chiro event. And then it gets really fun because let's say you're already in the non-surgical spinal decompression business. Now, what is each brick? Each brick now represents something different. It could be social media marketing. It could be ads. It could be inserts. It could be flyers. It could be books. It could be magazettes. It could be handouts. It could be health passes. You see, the key here is ammunition. The more ammunition you have, the more you will win this game as a chiropractor. I promise you. And the way to do that is simply this. March 6th, if you pick up a copy of the American Chiropractor and you pick up a copy of Chiropractic Economics, you're going to see this ad that's in there. It's a full-page ad where it talks about how to secure a seat at the Chiro event, how to learn the game plan for your dream cash practice. That's what this is all about, creating a dream cash practice. If you want to talk to doctors who've attended the Chiro event, you are more than welcome to speak to them. They've come from all over the country. These are some of the biggest players in the game. These are chiropractors that are already running a multi-million-dollar practice. We'll show examples and we'll talk about doctors like this who've attended the Chiro event. Some of you know him, Dr. Brian Hezzer from New Mexico. I've been in practice 23 years and I've been very successful. The one thing that I was lacking was a key component on how to really treat disc patients, bulging, herniated, and slip disc. Through Dr. Kaplan, Dr. Bart, I've been able to go up exponentially. I've helped so many more people avoid surgery. Everything you need is laid out for you in a beautiful presentation, down to the internet marketing, down to what you're going to hand a patient. We will show you examples, physical examples of this. All the information is there, all the research. And at the end of the day, if you don't want to reinvent the wheel, that's the secret. Don't reinvent the wheel. It's beautiful patients love it. Oh, by the way, I didn't mention this, but Dr. Hezzer happens to have one of the largest chiropractic centers in the country, one of the largest healing centers in the country. It is 30,000 square feet. Not too many chiropractors on the planet have a 30,000 square foot center. You'll meet doctors like this who've attended before. Dr. Kim Hong from Louisiana, who said there are so many successful doctors here. It's great to be able to rub shoulders with the best of the best in our profession. Dr. Kaplan is the godfather of this decompression, and Dr. Bart is amazing at marketing. Yeah, he's okay. So the two of them are like M&M. They're like marketing and management. When I heard Dr. Bard's story, it just gave me more of a drive to do what we do. It makes me want to be able to give more into the profession. So that is priceless. You'll meet doctors like Cameron Rowe. What a great story this is in Texas. Doctors like this who've attended. Before I attended, I struggled from month to month to pay my bills, to keep my staff paid, to pay my rent, and everything on time. Insurance has just dwindled down to nothing. We were really suffering. They showed me how to package and present cases of spinal decompression, of neuropathy, and of laser. It's been tremendous in the amount of services that I've been able to perform that are not insurance dependent. No more dependence. The communication is unmatched. If I text Dr. Kaplan, Dr. Bard, I get a text back. If I email them, I'll get an email back. They are always there. They're always available for me. The Cairo event made this happen. It is the coolest thing on the planet. You meet doctors like this, Kurt Simon in cold Wisconsin. We were just with him a few weeks ago. He was so awesome. Prior to attending Cairo event, my patients that were coming, they all wanted was 2 or 3 adjustments, get me out of pain and get me out of your office without addressing the problem. Well, guess what? That was my practice too, Dr. Simons. You're not fixing the cause. You're just giving them temporary relief. The Cairo event changed that. We've gone from just being a chiropractor to being a specialist. These guys are phenomenal. It is a family. They give you everything you need. I cannot say enough about Perry and Eric. If you don't believe it, call him today. He's awesome. These are the doctors. I think he's got 3 spinal decompression tables now. He started with, I think, just like many of you who didn't even have one. You meet doctors like this. Dr. Shelley Radoster, who with her husband, prior to attending, we didn't feel like we got compensated for the effort and the dedication and time that we put into caring for our patient. And just by accident, I happened to come across a webinar. Maybe it was a Zoom meeting just like that Drs. Kaplan and Bard were doing. We watched the webinar, got in contact with Dr. Bard, had an excellent conversation, and went to meet these guys at the Cairo event. It just felt right. That has made a huge difference in the way we feel about practicing and our practice ourselves. If anybody is struggling or just not happy with what they're doing, I would encourage you to reach out to us, have a conversation with us. He will answer all your questions. Yes, Dr. Kaplan can answer all your questions. I can answer all your questions, or our team will answer all your questions. This is what it is all about. You meet great doctors in the state of Florida like this. Graham Kern, who started with no spinal decompression. I believe he's up to 3 tables now. He set a record last week. I like what Dr. Bart says. The D for doctor stands for detective. And just doing more testing, especially the MRI. That's what we want you to come away with. We want you to become better doctors. We want you to be more of an authority, more credibility, more certainty, and more confidence in what you do. It has really, really taken our practice to a totally different level altogether. It's been a game changer for our practice. You'll be happy you attended just like I am. It'll change your life forever. We know it is not by chance you are with us here today on this Zoom meeting of the year, the first one of the year. If you want to learn more, what do you want to do? You want to grab a seat at the Cairo event, write it down. March 6th is the magic date. We've got brand new stuff. We cannot wait to show you. I've got goosebumps. I don't know if you can see it. Can you see it right here? Hair is standing up on my arms right now. My legs too, but I won't show you that. In terms of what we've got in the pipeline for you. You want to get on the phone. If you cannot get online, try to secure a seat. If there are seats left, if you get a pop-up window on the website, it means that it is completely sold out. You'll be given an option to go to a wait list, but only sometimes the wait list is opened up. You know how that works. 888-990-9660. We know for a simple fact that this is the training of the year. It is the most powerful chiral event that's ever been done. And we've got so many new things that we're ready, willing, and able to share with you that you have no idea what's coming. You ain't seen nothing yet. We had so much fun today. I hope you learned some stuff. And Dr. Kaplan, would you be so kind to take it home for us?
You know, let me tell you, Virgin Airways, Perry, the founder of Virgin Airways is who?
Richard Branson.
Thank you. And Branson said that there's three types of people, 3 I's, he calls it. He says there's the initiators, there's the imitators, and then there's the idiots. You see, Perry and I vote we're initiators, and I'll say this to people, point blank, listen, am I selling something here right now? You bet. I'll tell you what I'm selling. I'm selling you a better life. Do you realize that if I can help you close 1 case a month, a month, one a month, that's can be more than 3 times what you're paying me. And you cannot, nobody can look me in the eyes and tell me that they don't have more than one disc case. But you see, if you're still going to be dependent on the insurance companies, and you're going to still live in fear of the insurance companies, and if you're going to hope, if you go to bed and you say, oh, I hope that they're going to change and I hope they're going to pay me more, guess what? They're not. So you have 2 choices. Like I tell people at the end, you have 2 choices, doctors. One, you can either, do decompression or surgery, and I'm going to tell you why. And I'm going to tell you, doctors, you have 2 choices. Either, you can either go to work for the joint, or you can take control of your life and learn how to do this. Because what separates you from the joint? Have you ever asked yourself that? I remember when I looked to get my son his practice, he said, oh, Dad, there's a joint like a mile away. And I said, son, we're the anti-joint. So what I'm telling you as you sit there, for my non-doctors, and just so my doctors know this, and they'll all tell you, they can attend more than one. I mean, we don't stop them, but if you want a life-changing, I had the ability, Perry read those testimonials, but right in front of me, because of the way the pictures are set up, is Dr. Richard Partiti from Jersey, okay? And Richard, I'm going to put you on the spot again. I don't even know if Perry could let him talk. Could he talk for a second? If I ask him a question, could he answer it? If he doesn't answer it, good, Perry, we can always shut him off. But anyway.
Yeah, I can answer it.
So, no, Richard, now, and the only reason I'm choosing you is because you were there how many weeks ago?
3, maybe.
3 weeks ago. And, Richard was a very unique guy because, as I said, Richard did his homework. Richard spoke to people. And not only that, he understands decompression. I was so impressed with his knowledge of the science. We talked about the mechanics of the tables. We talked about the histopathology. I mean, my time with Richard, okay, and look at him with his arms crossed there. That's the type of report of findings he is, right, Richard? But if somebody was out there, Richard, you're 3 weeks, you became a member of the family. I know you're already getting a lot of stuff in the mail, right?
I am. Quite a bit.
Are you happy so far?
Absolutely.
What would you tell someone that's sitting there right now and they're saying, well, should I pick up the phone? Should I call? Would this be a life-changing event?
Being from New Jersey, we are skeptical of everybody. We trust no one. We did a lot of research. But if you have not been to this Cairo event, I highly recommend to go to it. Go to the Cairo event, listen to what they have to say. Other doctors will probably ask some of the questions that you're thinking, and then you can make up your mind from there. But absolutely go to the Cairo event. I'll be back down there, in a couple of weeks? It's less than 3, I think.
And are you excited?
Absolutely.
No, and that's
okay. So yesterday I sold the package before we even had anything, based on our information I got just from at the Cairo event.
How much did you sell the package for?
The package is $3,900.
See, so imagine he came to the event, $3,900 just from hanging out with Dr. Bart and myself, and you're sitting there saying, well, should I go? You bet your ass you need to go.
Yeah, absolutely.
Right? You need to get down here. You need to make a difference, because I'm going to tell you what, you're either an innovator, you're an imitator, or you're an idiot. Because I'm going to tell you, the window with insurance is closing, and you better know how to close these cases. And I'm so proud and that Richard, he hasn't even been to the M1 Day MBA, and just the knowledge he got, he already closed the case. Now, as I said to you, 1 a month is more than 3 times what you're paying me. Doctors, here's what I'm going to tell you. We teach you how to close, not just to talk to patients. And you hear what he said? Not that, oh, they agreed to come in. Now, Richard, can I ask you one more question?
Sure.
Was it a prepay?
No, she's got to make installments, but it's a lifetime patient. I'm okay with that.
See, I mean, the bottom line is, because we show people there's so many ways to capture the revenue, but the point is he's capturing the revenue. And that's what it is. I mean, we can go around the room. Where's Lesagio? Is he still around? I mean,
it's very funny. It's cold in Pennsylvania. So what does he do? I loved watching him because it was very funny. He took his clinic jacket off to just have lunch, eat some soup, get some information. See, guys like him are always learning. They came for for one thing today. They came for one way to say something, one way to phrase something, one piece of content, knowledge, education, research. That's why he was on, because, you know, we just saw him a few weeks ago and he's kicking such butt. He moved into a gorgeous DDG
New
office,
facility.
gorgeous. And he put on, so what does he do? He puts his clinic jacket on. This centers, can you see that? This centers of America. Baby. He brands it. He puts his, you know what it reminded me of? It's like an athlete that puts his game uniform on because he's going back out on the floor to help, to treat, to heal. I love it.
You know, Perry, when they understand that what's taking place in chiropractic, it's also taking place around the world. I mean, if you look at one of the recent studies out of the University of Heidelberg in Germany, University of Heidelberg in Germany, and again, so you have, okay, Dr. Gerling, Dr. Lorenz, Dr. Engelleiter, Dr. Richter, okay, and then what are they saying? That this distraction shows evidence of regenerative potential in the generated intervertebral disc as evaluated by protein expression, magnetic resonant imaging, and messenger ribonucleic acid expression analysis. Now, all my patients, all my clients, you know, if you want this study, you know, I mean, I will get a copy of it to you somehow for coming here today. But what I'm saying is, this is taking place around the world. Research is being done on spinal decompression. So I'm saying to you, doctors, are you in the game? Are you treating subluxations? Are you diagnosing them? Okay. Are you doing it the way you're supposed to do it? If you're not, if you're a client, get your ass back down to another boot camp. If you're not a client, get your ass to an event. I mean, I love when I heard Richard say, he's a Jersey boy, I'm a Jersey boy. We are skeptics. The only biggest skeptics than us, Richard, are the Brooklyn guys, which is Perry Bard, right? You know? So, I mean, that's the way it is. But here's what we're doing. We're changing lives, doctors. You know, I just don't want the profession to go away. You know, I tell the story at the event. When my younger son, my oldest son went to medical school, for the record, and my younger son went to chiropractic school, and my younger son's much happier. He loves what he does. But when he came to me and said he wanted to be a chiropractor, I'm going to tell you these words I said to him, okay? It's a great profession. It's a tough business. And that's the way it is. And if you're insurance dependent, it ain't going to happen. Come down to the event. Okay, look, just like Richard, who came from Jersey, didn't expect to have such a great day. Now he's family, and he's already closing cases. And you know what? The party's just begun. So I want to take this opportunity by myself and Richard, and Richard, thank you so much, you know, for your help, and Perry and all the guys out there. And I'm going to ask you this question: are you happy? Is your practice where you want it to be? And we've all heard this. If you do the same thing the same way, you get the same result. Is it time for change? Yes. Can I help you change? Yes. Will it be one of the best days you've ever spent? Yes. So what I'm saying is, you're either happy or you're not happy. You're either going to become employed by the joint or have a practice that makes the money of the joint, or you're going to become a disc specialist. If you don't want to be ordinary and you want to be extraordinary, the only difference between ordinary and extraordinary is just the extra. Give it the extra. I look forward to meeting in Florida. Let me knock your socks off. I'm Dr. Kaplan with the greatest partner in the world, Dr. Perry Bard, saying be there or be square. Thank you.